What if the dumbest medical ideas actually saved lives? Tonight, we unpack leeches, maggots, and literal poop transplants, plus the explosive that calms hearts, and cocaine for surgery. Ancient Romans used electric fish. Victorians blew smoke, literally. Some cures were brilliant accidents, others reckless. A few, both. We'll show what happened, where, and why doctors tried them. Spoiler, hospitals still use several, with sterile lab coats. Stick around, because the strangest one actually fixed newborns. Let's dive into 39 dumb cures that somehow worked. Variolation sounds insane. Deliberate smallpox to prevent smallpox. Smallpox deaths dropped after people were intentionally exposed to smallpox. In Ottoman Turkey, variolators scratched scabs into skin under supervision. Lady Mary Wortley Montagu sawed in Constantinople and advocated home. In 1721 Boston, Cotton Mather pushed trials during a severe outbreak. Inoculators targeted the skin, not lungs, to lower fatal risk. Patients often developed mild illness, then lasting protection against deadly epidemics. Communities faced fierce backlash, yet results persuaded wary city leaders. Risk remained real, but survival odds tilted hard toward inoculated families. Without this step, Jenner's later vaccine might have never gained traction. Jenner's cowpox inoculation looked crazy, but it stopped smallpox. Smallpox vanished where cowpox scratched arms before the virus arrived. In 1796, Gloucestershire, Edward Jenner used cowpox from Sarah Nelmes. He inoculated young James Phipps, then later challenged with smallpox material. The boy didn't sicken, stunning colleagues across London's medical circles. Milkmaid's immunity rumor suddenly had a testable, repeatable explanation. Jenner published cases and sent vaccine threads through Global Mail. Napoleonic armies, then American towns, built campaigns around cowpox vaccination. Religious objections flared, yet mortality charts kept changing stubborn minds. That barnyard gamble birthed the blueprint for modern immunization programs. Bloodletting actually works for hemochromatosis and polycythemia. Bloodletting saved lives when iron or red cells climbed dangerously high. In hereditary hemochromatosis, extra iron damages liver, heart, and pancreas. Therapeutic phlebotomy removes iron load faster than any pill could. Polycythemia vera thickens blood. Drawing pints lowers clotting and stroke risk. Hospitals schedule regular phlebotomies like oil changes for human engines. Old barber poles hint at medieval bleeding, mostly harmful and random. Modern protocols use labs, volumes, and frequency tailored to physiology. Patients often report clearer thinking and fewer headaches after sessions. Sometimes the medieval tool works, with math and monitoring attached. Leeches saved reattached fingers by draining congested venous blood. Microsurgeons kept replanted ears pink because leeches drank slowly. After reattachment, tiny veins clog first, starving tissues of outflow. Hirudo medicinalis latches on, secreting anticoagulants that keep blood moving. Hospitals maintain leech pharmacies, complete with cups and careful handling. A nurse logs each leech's shift like a very odd coworker. When veins reopen, leeches retire, and swelling finally settles down. Plastic surgeons credit them with tipping marginal cases into survival. Yes, they squirm. Yes, they occasionally wander under dressings unexpectedly. But they've rescued noses, lips, and fingertips since modern microsurgery's dawn. Sterile maggots clean wounds and stop dangerous infections. Amputations were avoided because lab-grown larvae ate only dead tissue. World War I surgeons noticed filthy wounds healing after fly infestations. Decades later, researchers raised Lucilia serracata larvae in sterile facilities. When placed in dressings, maggots debride slough, killing bacteria chemically. They secrete enzymes, leaving healthy tissue surprisingly untouched and pink. Patients feel tickling, not chewing. Nurses monitor counts like inventory. Chronic ulcers that defied antibiotics sometimes turned around within days. Hospitals bill it as biosurgery with consent forms and timing. It's gross on paper, miraculous on stubborn diabetic feet. Fecal microbiota transplants cured recurrent C.diff infections. Relentless diarrhea stopped when healthy microbes moved into broken guts. After antibiotics, Clostridioides difficile can overgrow and poison the colon. Doctors infuse screened donor stool via colonoscopy, capsules, or nasogastric tubes. Suddenly, the neighborhood changes, and the bully bacteria lose territory. Cure rates for recurrent cases stunned infection specialists across major centers. Programs developed strict donor screening to block viruses and hidden pathogens. Patients describe overnight transformations after months changed to bathrooms. Regulators created pathways for controlled access and tracked long-term outcomes. It's recycling, yes, but it gave desperate patients normal lives back. Electric fish shocks eased gout and headaches in antiquity. Pain eased when Romans placed torpedo rays under aching feet. Physician Scribonius Largus described numbing shocks as natural anesthesia. Gouty nobles reportedly stood on fish until tingling replaced agony. Headaches sometimes lifted after carefully timed jolts near the forehead. No wires, no batteries, just Mediterranean biology delivering therapeutic current. Later, scientists chased controlled electricity, birthing devices, and anesthesia breakthroughs. Those seaside experiments foreshadowed modern nerve stimulators and TENS units. Ancient trial and error occasionally sparked surprisingly modern-looking solutions. Sometimes the ocean literally powered a clinic without knowing it. Tobacco smoke enemas for drowning victims sometimes restarted breathing. Cold, lifeless bodies sometimes gasped again on London's riverbanks. The Royal Humane Society placed resuscitation kits along the Thames. Volunteers used bellows to push tobacco smoke into the rectum. The theory targeted warmth, stimulation, and absorption through intestinal walls. Some hypothermic near-drownings revived, at least according to recorded reports. Later, physicians questioned method, dose, and tobacco's real physiologic effects. As mouth-to-mouth and chest compressions matured, the fad faded. Still, early public rescue stations showed communities could organize fast help. Even strange tools paved the road toward modern emergency medicine. Heroin cough syrup quieted night coughs too well. Parents finally slept because diacetyl morphine hushed relentless coughing. Around 1898, Bayer marketed heroin as a gentler morphine alternative. Physicians prescribed bottles across Europe and American city pharmacies. It worked, but dependence and withdrawal soon appeared everywhere. Doctors reversed course, restricting narcotics and warning about easy bottles. Codeine, not heroin, later carried most legitimate cough suppression duties. The brand name vanished, but the lesson echoed through regulations. Sleep came quickly, and trouble followed even faster afterward. Sometimes medicine's first success hides a second, darker invoice. Cocaine toothache drops truly numbed pain as local anesthetic. A numb gum meant sleep after days of throbbing molar misery. In the 1880s, Carl Kohler showed cocaine's powerful numbing for eye surgery. Pharmacists sold cocaine toothache drops in small amber bottles. Pain vanished within minutes, surprising patients and eager dentists. Addiction and toxicity risks emerged as usage spread rapidly. Safer synthetic relatives like procaine and lidocaine replaced street-dangerous origins. Still, the pharmacology lesson shaped modern dentistry and nerve blocks. Early labels promised relief. Later labels screamed caution in capitals. From vaudeville tonic to operating room tool, the path was jagged. Arsenic trioxide became a curative drug for leukemia, APL. Leukemia remissions followed a poison once notorious in murder mysteries. Chinese researchers revived arsenic trioxide for acute promyelocytic leukemia. Combining it with targeted agents pushed survival dramatically upward. Hospitals monitor electrolytes closely, preventing dangerous rhythm problems. Patients swallow tiny doses under oncology nurses' watchful eyes. The ancient toxin suddenly wore a white coat confidently. Regulatory approvals followed as trials replicated remarkable response rates. Even skeptics acknowledged the turnaround for this leukemia subtype. A villain from history became a lifesaver in oncology clinics. Thalidomide returned to treat leprosy complications and myeloma. A drug once maimed newborns returned with locked safety protocols. In the 1960s, thalidomide caused catastrophic birth defects worldwide. Years later, physicians found it calmed leprosy's painful inflammatory reactions. Careful programs mandated pregnancy testing and strict distribution monitoring. Then, multiple myeloma patients saw meaningful responses to thalidomide combinations. Derivatives like lenalidomide improved potency and reduced some side effects. Oncology wards balanced benefits with ironclad contraception counseling. The name stayed radioactive. The results surprisingly persuasive. Sometimes redemption only occurs with guardrails bolted on tightly. Botulinum toxin injections relieve migraines and dystonia symptoms. Faces softened and headaches shortened after microdoses of deadly toxin. Ophthalmologists first used botulinum toxin for crossed eyes and spasms. Parents noticed smoother foreheads, then migraine days dropping sharply. Neurologists mapped injection sites across scalp, neck, and shoulders. Dystonia patients regained steadier handwriting and more natural posture. Doses are measured in mouse units under strict dilution controls. Allergens programs trained clinicians, preventing diffusion to unwanted muscles. Side effects often faded as placement techniques improved steadily. A feared bacterium became an outpatient tune-up for misfiring nerves. Ketamine's dissociative dose rapidly lifts suicidal depression. Emergency rooms watch despair lift within hours after ketamine infusions. An old anesthetic suddenly targeted glutamate, a different brain pathway. Patients reported colors brighter and thoughts less trapped afterward. Clinics adopted monitored protocols with blood pressure and dissociation checks. Esketamine nasal sprays followed, delivered under observation with counseling. Not everyone responds, and benefits can fade without maintenance. Still, speed matters when timelines are measured in crisis minutes. Researchers refined dosing to balance relief and tolerability carefully. A club drug's cousin found a guarded home in psychiatry. Psychedelic-assisted therapy shows lasting relief for PTSD and depression. Trauma nightmares eased for some after guided psychedelic sessions. Clinicians paired MDMA or psilocybin with structured psychotherapy protocols. Participants prepared carefully, then processed memories during supervised sessions. Follow-ups reported improved function months beyond the dosing day. Regulators scrutinized trial designs, safety, and potential for misuse. Veterans and patients pushed for pathways reflecting measured benefits. Not every study agreed, and training standards remained essential. Still, many described relief where years of talk failed. Ancient compounds returned through modern clipboards and cautious clinical rooms. Bacteriophage therapy outsmarted antibiotic-resistant infections in clinics. Superbug infections cracked when viruses targeted bacteria with precision. Institutes in Tbilisi and Warsaw kept phage libraries for decades. A San Diego patient with resistant Acinetobacter improved after tailored phages. Doctors matched phages to cultures, like the spoke keys for locks. Regulatory teams approved compassionate use, while data accumulated. Combination strategies reduced resistance by rotating viral predators regularly. Patients who'd exhausted antibiotics finally left isolation rooms smiling. Western labs built repositories, translating long-standing Georgian experience. Medicine borrowed microscopic hunters from nature's vast toolbox again. Activated charcoal slurry saves lives after acute poisoning. Tox screens improved outcomes when black slurry arrived quickly. Charcoal's porous surface trapped drugs before they crossed gut walls. Emergency departments mixed it into cups and plastic bottles. Taste was awful, but absorption curves told the story. Paramedics sometimes pre-alerted hospitals for immediate decontamination readiness. It's not universal. Caustics and metals need different strategies. Still, for many overdoses, timing beat nearly everything else. Triage nurses pushed straws and encouragement with quiet urgency. A messy drink quietly redirected dangerous molecules toward the exit. Duct tape occlusion therapy helps stubborn warts disappear. Months-old warts sometimes peeled away after weeks under duct tape. Dermatologists suggested suffocation, irritation, and immune activation as mechanisms. Parents cut small squares and changed them every several days. Some studies showed success, others found results roughly comparable. Salicylic acid still partnered well with the tape regimen. Kids liked the story better than freezing guns and blisters. Family calendars tracked rotation days like tiny project plans. When it worked, the reveal satisfied everyone instantly and cheaply. A hardware aisle hack briefly outperformed a clinical-looking tray. Honey dressings sterilize wounds and speed tissue healing. Chronic ulcers closed after nurses packed them with medical honey. New Zealand's Manuka varieties gained attention for potent antimicrobial activity. Professor Peter Mullen helped document mechanisms and clinical outcomes. Honey's low water activity starved bacteria without harming granulation tissue. Dressings stayed moist, reducing pain when changed by caregivers. Soldiers historically smeared honey. Now hospitals prescribe labeled packets. Cultures still guide antibiotics when deeper infections threaten bones, but surface healing often accelerates under those amber gauzes. Beework quietly leapfrogged some lab-made ointments on stubborn wounds. Granulated sugar packs starve bacteria and heal infected wounds. Badly infected cavities dried out and stopped smelling after sugar. Dr. Moses Marandu championed the technique from Zimbabwe to Wolverhampton. Sugar draws fluid osmotically, dehydrating bacteria and sloughing debris. Nurses packed cavities, then covered with sterile secondary dressings. Pain often eased as inflammation and odor dropped significantly. Randomized studies grew, testing dose, change frequency, and combinations. It's cheap, available, and surprisingly friendly to low-resource clinics. Not a panacea, but a powerful tool against biofilm. Sometimes the grocery aisle outperforms a locked medicine cabinet. Super glue sprays sealed bleeding wounds on Vietnam battlefields. Bleeding slowed when medics misted cyanoacrylate over ragged edges. Eastman 910, a fast-bonding adhesive, formed temporary hemostatic films. Surgeons later closed definitively once patients reached safer facilities. Toxicity worries kept early use strictly limited to emergencies. Derivatives like 2-octyl cyanoacrylate entered operating rooms as skin sealants. ER teams now glue small lacerations instead of stitching everything. Parents appreciate faster closures and fewer screaming suture removals. Field improvisation nudged industry toward regulated medical formulations. A lab accident became a battlefield stopgap, then a clinic staple. Willow bark tea. Soothed pain, prototype to modern aspirin. Fevers dropped when villagers brewed willow twigs into tea. 19th century chemists isolated salicin, then refined acetyl salicylic acid. Bayer popularized tablets that tamed headaches and inflammatory aches. Cardiologists later leveraged platelets to prevent heart attacks. Ringing ears warned about dose long before printed inserts existed. Doctors balanced bleeding risk with undeniable everyday relief. From riverbanks to pharmacy shelves, the lineage stayed clear. Migraines, fevers, and joint flares all met simpler mornings. Nature whispered. Chemistry translated. Households kept bottles within reach. Foxglove folk remedy became digitalis for failing hearts. Swollen ankles shrank after carefully dosed digitalis strengthened contractions. In the 1770s, William Withering investigated a Shropshire folk potion. A wise woman's foxglove tea reportedly transformed a dying patient. Withering standardized extracts and warned about narrow safety margins. Physicians learned to watch pulses and nausea for overdose. Today, digoxin remains for select heart failure and rate control. Electrolytes, kidney function, and drug interactions dictate careful dosing. That purple garden flower quietly reshaped cardiology's earliest toolkit. Folk knowledge seeded one of medicine's longest-running prescriptions. Blue light therapy reversed newborn jaundice safely and fast. Yellow babies turned pink under lamps above maternity wards. A British nurse noticed sunlit infants had lower bilirubin levels. Physicians tested blue wavelengths, breaking bilirubin into excretable fragments. Phototherapy rigs spread from Essex to hospitals worldwide. Nurses shielded eyes and tracked temperatures during long sessions. Exchange transfusions dropped as safer lights took center stage. Parents watched numbers fall without needles crossing tiny veins. Engineers improved LEDs, making mobile units for rural clinics. A sunbeam observation became a neonatal standard of care. UV phototherapy calms psoriasis and eczema flares. Red plaques faded after carefully dosed ultraviolet sessions weekly. Niels Finsen pioneered medical light for skin tuberculosis in Copenhagen. Later, dermatologists refined UVB and PUVA for inflammatory rashes. Patients stand in cabinets while timers control exposure seconds. Goggles protect eyes. Emollients support the healing barrier afterward. Remissions can last weeks, reducing steroid and pill dependence. Relapses happen, but cycles often flatten the worst spikes. Scheduling matters, like charging a battery against recurring flares. Sunlight, tamed and measured, became a prescription many trust. Tilapia fish skin bandages soothe and heal severe burns. Burn patients found relief under unexpected silver blue fish skins. In Fortaleza, Brazil, Dr. Edmar Maciel led pioneering trials. Tilapia skin adheres, stays moist, and delivers collagen to wounds. Patients reported less pain and fewer frequent dressing changes. Suppliers sterilized skins, then stored them chilled for deployment. Television crews filmed startled reactions inside Brazilian burn units. Infections dropped when handling decreased, and coverage stayed consistent. International teams studied scaling, sourcing, and cultural acceptance carefully. A common food suddenly dressed catastrophic injuries with dignity. Neti pot nasal rinses relieve sinusitis when water is sterile. Congestion lifted after warm saline rinsed swollen nasal passages. Ayurvedic Jala Neti traveled from India to American bathrooms. Doctors warned, use sterile, boiled, or distilled water only. Rare brain infections traced to tap water contaminated with amoebae. When prepared correctly, irrigation flushes allergens and thick secretions efficiently. Patients breathe easier, sleep quieter, and snore a little less. ENT guidelines integrate rinses with sprays and sometimes antibiotics. Measuring salt matters. Too strong burns, too weak feels useless. Simple pots demand precision that bottled sprays mostly hide. Bismuth subsalicylate settles stomach bugs and traveler's diarrhea. Vacation disasters eased after swigs of familiar pink liquid. Bismuth coats the gut, calms inflammation, and slows fluid loss. Salicylate adds anti-inflammatory punch against cramping discomfort. Travel clinics sometimes suggest preventive dosing in risky areas. Darkened tongue and stool spook newcomers, but remain harmless. Aspirin allergies and anticoagulants warrant pharmacists' quick counsel. Hydration still rules, the pink just steadies the ride. From lunch carts to hotel minibars, it's universally recognized. A small capful often rescues long-awaited plans abroad. Brewer's yeast cured pellagra before we knew about niacin. Skin rashes faded when patients ate brewer's yeast daily. In the American South, pellagra devastated poor communities seasonally. Public health Dr. Joseph Goldberger changed diets in orphanages and prisons. He proved deficiency, not infection, drove the mysterious 3Ds. Yeast and protein-rich foods reversed symptoms within days for many. He even staged demonstrations to fight stigma and policy inertia. Later, scientists identified niacin as the key missing vitamin. Fortification programs slashed cases across flour and staple foods. Nutrition science matured because one skeptic followed ordinary breadcrumbs. Raw liver diet saved pernicious anemia before vitamin B12. Patients rose from bed after enormous servings of liver. At Boston hospitals, Minot and Murphy fed astonishing daily portions. Whipple's dog experiments hinted at blood-building factors in meat. Before B12 isolation, liver delivered the life-saving ingredient, unknowingly. Tongues pinked up, weakness receded, transfusions became less frequent. Eventually, cyanocobalamin injections replaced mountains of cooked organs. Nobel recognition followed for decoding the mystery anemia. The path was messy, the outcome unmistakably bright. Kitchen plates briefly outperformed laboratories in treating a lethal disease. Snake venom inspired ACE inhibitors for high blood pressure. Strokes were prevented thanks to peptides from Brazilian pit viper. Researcher Sergio Ferreira studied bradykinin-enhancing toxins in Sao Paulo. At Squibb, David Cushman and Miguel Ondetti refined oral captopril. Blood pressures dropped reliably without crippling fatigue or diuretic cramps. Patients tolerated side effects like cough far better than alternatives. Drug classes multiplied, protecting kidneys and hearts worldwide. Field venom turned into a daily morning lifesaver. Biology's nastiest tricks sometimes teach medicine its gentlest moves. A jungle whisper re-engineered suburban pharmacy shelves permanently. Mustard gas derivatives became the first chemotherapy. Lymphomas shrank after derivatives of a battlefield poison. After the Bari Harbor disaster, doctors noticed suppressed white cells. Yale researchers Goodman and Gilman tested nitrogen mustard carefully. Tumors responded, launching oncology's long, brutal, hopeful journey. Patients endured nausea for months of added, precious time. Combination regimens later pushed survival curves even further. War's horror unwillingly offered clues for saving lives. Ethics evolved alongside informed consent and protections afterward. Weapons research accidentally seeded the first oncology playbook. Malaria fever therapy cured. Neurosyphilis before antibiotics. Psychiatric wards celebrated when fevers cleared syphilitic madness. In Vienna, Julius Wagner Jahreg inoculated patients with malaria parasites. High fevers damaged the bacteria attacking the brain. Afterward, quinine treated the malaria, ending the dangerous cycle. The method carried risk, yet outcomes beat certain decline. As penicillin arrived, clinics retired the drastic fevers. Still, Nobel recognition marked a grimly ingenious solution. Hospitals learned to chase controlled extremes when options were few. Fire fought fire, then stepped aside for cleaner tools. Atropine, from deadly nightshade, treats bradycardia and poisonings. Slow pulses sped up after injections drawn from belladonna. Paramedics use atropine for dangerous heart block on ambulances. Toxicologists reach for it during organophosphate pesticide poisonings. Pupils dilate under eye drops for certain exams. Doses demand care. Dry mouth and confusion warn of excess. Garden berries that once killed now sit behind crash carts. Old plant lore became a standardized hospital antidote. Training drills keep timing sharp for high-stakes scenarios. Witchcraft's herb ended up rescuing farmers and grandparents alike. Nitroglycerin, an explosive, relieves crushing angina chest pain. Tight chests loosened after tiny tablets dissolved under tongues. In the 1870s, William Murrell documented nitroglycerin's vascular magic. Headaches announced dose. Relief announced restored coronary blood flow. Alfred Nobel struggled with angina and disliked the irony deeply. Patches and sprays later offered steadier, safer delivery options. Emergency rooms still reach for fast-acting sublingual formulations. Cardiologists pair it with risk control and artery-opening procedures. An industrial hazard became a lifesaver in jacket pockets. Boom turned into a calm breath on city sidewalks. Moldy bread poultices sometimes helped thanks to penicillium molds. Infections quieted under crude poultices smelling like forgotten pantries. Ancient Egyptian texts described bread-based dressings for wounds. Penicillium species can produce antibacterial compounds in the right conditions. Of course, contamination risk made outcomes wildly unpredictable historically. Fleming's later penicillin purified that messy household observation. Hospitals learned controlled fermentation beats random kitchen science every time. Still, soldiers and villagers occasionally lucked into microbial help. A musty slice hinted at an antibiotic revolution ahead. Serendipity visited centuries before petri dishes confirmed the trick. Helminth therapy showed promise for Crohn's and allergic disease. Some patients improved after swallowing microscopic parasite eggs. Gastroenterologist Joel Weinstock explored immune calming via Trichuris suis. Early trials reported reductions in inflammatory bowel flare frequency. Regulators demanded larger studies and clearer safety endpoints. Results proved mixed, but mechanisms taught immunologists valuable lessons. Hygiene and overactive immunity might intertwine more than expected. Clinics moved cautiously, avoiding unsupervised experimentation entirely. Meanwhile, targeted biologics advanced in parallel rapidly. Parasites unexpectedly tutored modern drugs on dialing inflammation down. Sunlight therapy and cod liver oil cured childhood rickets. Rickets rates plunged when kids got sunshine and cod liver oil. Industrial-era Britain saw bowed legs in cloudy, smoggy neighborhoods. Physicians promoted outdoor schools and fortified foods aggressively. Researchers tied vitamin D to calcium absorption and bone strength. Sir Edward Mellanby's work clarified deficiency during controlled animal diets. Public health campaigns distributed bottles in Scotland schools. By mid-century, fortified milk and cereals shifted baselines. Pediatric wards watched braces and fractures steadily decline. A vitamin, a window, and a spoon changed childhoods. Radon spa babs eased arthritis pain. Controversial relief. Aches eased for weeks after sessions in Austrian radon tunnels. Bad Gasteins Heilstollen Clinic draws visitors with warm, humid air. Patients rest on cots deep inside former mining galleries. Low-dose radiation theories claim anti-inflammatory immune modulation afterward. Skeptics push for sham-controlled trials and longer follow-ups. Still, repeat visitors swear their stares become manageable again. Doctors warn against overuse and screen for cancer histories. Tourism and therapy blur inside mountain towns built on springs. A radioactive whisper remains a stubborn, debated tradition in Europe.